A pretty common question I get from parents as a pediatric psychologist is impact of social media on child's development, mood, mental health, all that good stuff. And right now, of course, we don't have that much research, but there is some pretty good research coming out about the impact of social media and mental health. And I think the reality is that we can't protect kids from not accessing social media. So I think it is important to be aware of what the possible effects are so that we can be having educational conversations and talking about things in moderation. Because one of the most important things to note is that the impact of social media on mental health is dose dependent. So if your teenager is spending more than 3 hours a day on social media, that would be more concerning than if they just kind of do an hour or less. And that is due to kind of impact on sleep because we're on our phones later. It's also cyberbullying, social comparisons, and all that kind of stuff, as well as like misinformation can also be something that I didn't necessarily see that in the study I was reading, but just something that I've been thinking about is how much misinformation there is online and kind of all the self-diagnosing going on. So all those things are something to consider when it comes to social media. Even having positive social interactions doesn't necessarily cancel out the negative kind of effects of social media use. So while we can't fully remove social media from our lives, nor should we necessarily, it is important to monitor just how much time kids and teens are spending on social media. I think this is applicable also for adults, most likely. So I'm going to try to take my own advice tonight.